Can your firm sustain continuous innovation? It must. So let's look at continuous innovation through the experience of one who has led the process for many successful decades.
This is the Economics for Business podcast. We are here to help all businesses become champions for customers and value, improving lives with preferred and innovative products and services. We offer you the knowledge and tools to make your entrepreneurial journey a successful one. Now, here's your host, Hunter Hastings.
Hi, Hunter Hastings here. Continuous innovation can be an intimidating concept. Continuous implies no rest, no pause, no letting up on the innovation imperative. And that's exactly the case. As a consequence of a concept that is most highly developed in Austrian economics, although not elsewhere, the theory of expectations. Markets are processes generated by the expectations of economic agents, most notably customers. What we call subjective value is related to expectations. It is customer expectations that determine what will be deemed as valuable in the future, which is the target of innovation. Think of Amazon.com as an assembly of capital and processes to meet rapidly advancing customer expectations about retail, about what they can buy, whether it's in stock, whether it can be delivered in a day, or 8 hours, or 5 hours, to the location of the customer's choice. Some of those expectations were created by Amazon, and then they're escalated by customers going to the next level. If I can order at the last minute and get an item delivered in 2 days, and it worked, the promise was kept, then why not the same day, or in a 2-hour window, or immediately? If Amazon creates an expectation, customers naturally escalate. And they escalate not just for Amazon, but for every other website that they visit. There's a new standard. Your business must at least meet it, but the demand will soon be there to exceed it. I expect my Apple Watch to report to me on my workout. Right now, I've been told I have to go to the health app on my iPhone to get more detailed reporting, and the app is not free. My expectations are that I'll be able to get that information free in the future from someone, and I'll be looking around for a service to meet that expectation, even if it's unreasonable. I've escalated. Continuous innovation keeps track of expectations, doesn't fall behind, potentially jumps ahead, thereby creating new expectations, of course. Continuous innovation develops mechanisms to track expectations data and mechanisms to translate the information into the production and delivery of innovation. It's an onerous undertaking and requires thoughtful and responsive and adaptive organizational engineering. Today's innovator is a business leader who has tackled and accomplished this feat in a highly challenging field with sky-high expectations and a rapidly changing technology environment, healthcare. He is Joe Matarese, the founder and now executive chairman of Medicus Healthcare Solutions. Joe was a senior executive in a big global IT professional services corporation. Then he founded Medicus in 2004 to bring customized consulting and physician staffing services to healthcare organizations. He's been on the front line of innovation and changing customer expectations for a long time, and we are privileged that he will share some of his knowledge, experience, and insights with us today. Joe, welcome again to the Economics for Business podcast.
Thanks, Hunter. Good afternoon.
We're going to talk about innovation today and about continuous innovation. And you've had experience from all directions, Joe, on that. You've been a high-level executive in the corporate world, so you've seen it from that angle. You became the founder of a brand new startup, 3 chairs in a bedroom, if I remember correctly from our last discussion.
Actually,
Then,
it was that was actually right. You have a good memory.
then you became CEO of and now executive chairman of a high-growth industry-leading business that came from that startup. So you've seen this rapid flow of change from multiple perspectives. And one of your conclusions that you mentioned last time we're going to talk about today is that firms of all kinds and all sizes in all industries can't survive without what you referred to as continuous innovation. So that's where we're going to start. Let's have you tell us what you think about continuous innovation.
Sure. Well, let me just actually begin with innovation as a startup, meaning that an entrepreneur looks into the marketplace and sees that there's some deficiencies And in order to take advantage of those deficiencies by operationalizing a business, there has to be some type of innovation to start. What are you doing better than the next person, the next company? And so it starts with innovation. Innovation gets you into the game. And then once you're in order to stay relevant, you have to continuously innovate. Now, people tend to think that innovation is a great invention, never seen before, and it just jumps on the scene like Instagram or Facebook or the iPhone. But really, it's really the day-to-day incremental changes that you make to a product, to a process, to allow you to continue to meet customers' expectations and needs. And so it's super important that you keep your eye on the ball of what's changing in the marketplace and what the sentiment is of the consumer. So as you're able to make those changes innovatively, you're also changing processes internally so you could keep prices down, so it's competitive, but also given the product or service that the market expects or wants. The better you do that, the faster your company grows.
To some extent, Joe, that's a mindset. We often see in the management literature terms like defending your market share or maintaining your business. But it sounds like continuous innovation is a mindset. You got to think critically and creatively at all times. You got to say, what can I do better? What am I doing that's not good enough?
I think that it's a great point. And I think companies that die end up having a defensive posture. And unfortunately, there's a lot of internal inertia that pushes the fiefdom, the managers, to protect their group, their vertical, their department, really at the expense of any type of change. Now, that shouldn't be surprising to the listeners, I would imagine, because people tend to be risk adverse and people tend not to like change by and large. So, in order to have this continuous innovation, there's these competing forces, and they're very, very strong. And so, in order for a company to continue to innovate, it starts from the leadership, and it leads to a culture that allows the innovation to happen. And most companies cannot get there. And you can see it even in the most innovative companies. Google did an unbelievable job with search, but they've been having a difficult time moving forward with really developing anything else that's new. And so it's very, very hard for companies, regardless of how tech enabled they are, because of the culture and the general population of employees who push against that continuous improvement. And it really does impact the business. So what do companies do? They end up acquiring. I mean, if you think about Snapchat, Snapchat really should have been Facebook's. Facebook already had the infrastructure, but yet a third-party company develops that technology because Facebook couldn't respond fast enough for whatever reason.
Mm-hmm.
Instagram, same kind of thing.
So how do you get that mindset into the company, Joe? You said there were two opposing forces. Are you setting up resistance to the negative force? Are you amplifying the positive force? How do you get the positive force to be the one that wins?
I think that's really the challenge. I think as a business owner, I think it's very hard because you have to set the stage and initially as a cultural norm that we're going to continue to innovate. But when you continue to innovate, particularly processes, you're really undoing a process that somebody else had championed prior. And that person, takes a defensive position against that, and they don't want that new process to materialize, perhaps. And so it's a constant battle between changing and status quo. And I think that it is a mindset, and there are things that you can do to implement in a company, like, let's say, Six Sigma or lean type of mentality, where you're rewarding people for innovation. If somebody can take a process and reduce it by 15 minutes, 15 seconds, whatever the metric is, then that should be rewarded.
Yep.
I remember, of course, we're in healthcare, and when Obamacare came up, one of the key attributes was to save costs, and there was some consultants that recognized there's a county in New Jersey. It's called Camden, New Jersey. It's a very it's a poor area of the state, and what somebody recognized was that 80% of the Medicare cost was basically in 2-3 square blocks. And they wanted to know a little bit more about that. And so they did a little bit of research, and they figured out that it was a very unhealthy demographic. And they put some processes in place. They were able to save $7 million annualized to Medicare. And what their objective was to say, we want 20% of the savings. If we save you nothing, we get nothing. If we save you, we want 20% of it.
Mhm.
CMS declined the offer. It was
Wow.
unfathomable for them, because theoretically, that could have been a massive number, right? That consultant, that company could have operationalized it, and literally they could have been making millions. And so there was a lot of resistance, even though CMS would have been the benefactor of the savings, the 80% of the savings. Yet they didn't see it that way. And they didn't allow the consultants to continue on the good work that they were doing.
Yeah.
So
Didn't want to pay for
it's how
progress. Huh?
they didn't want to pay for progress.
Yeah.
And so as a business leader, now, of course, that's government. And so maybe perhaps that, there's some perverse incentive there. But even in the business setting, you have that same sort of resistance, because people don't want to necessarily learn a new process, or they're too embedded in the existing process. Or what we find in my business oftentimes is people are super worried that their technology is gonna edge them out of an actual job.
Mhm. Yeah, so let's drill into that, Joe. So one of the tools we can use to overcome the resistance and positively accelerate innovation is technology, adopt technology, because technology is innovating by itself, right? It's out there continuously improving, and then a firm has the opportunity to adopt it, and you can increase the speed of processes or lower the cost, or other things. So is the adoption of new technologies one way to make this process happen?
Absolutely, it is. It's usually the primary way. The trick is to get the people to adopt it and to train them, because they know what you should. Again, part of it's training. If they know that they're going to become more productive, their wages generally will rise. And I think that there's a disconnection from the economic understanding of how wages actually rise. It tends to be through increased productivity. And in order to become more productive, I use modern day tools, technology, in other words, to do my job better. Now, the way they see it is, wait a minute, we have 5 people doing payroll. Are you telling me all I have to do is press a button and I can do payroll that way? Well, if that's the answer, then maybe we don't need 5, we only need 1. That
Mhm.
scares people, even though the other 4 could be redeployed in the business elsewhere, or somewhere else in the economy. Back 200 years ago, everyone was worried, when we were an agrarian society, what would actually happen as it became mechanized, and people would say robots are going to, quote, replace people. Well, did robots replace people? And as you can see in modern day, the society has gone from 99% agrarian to like 2% agrarian, and yet guess what? Everyone's working. In fact, in today's world, we have a massive labor shortage, so we don't have enough workers. So this idea is just a misunderstanding of basic economics.
Yeah.
But it's
Yeah,
a
we got to.
powerful thing, Hunter, because it really does impact their viewpoint and the way that they passively aggressively work.
Yeah, we've got to find a way to get people excited about that, excited that they could do more, they could be more productive.
100%.
So the other tool that we always talk about, Joe, in helping innovation along is really truly deeply understanding and serving the customer, because they're always being offered new choices. They're always being offered by your competition or by technology new ways to do things. So just by understanding the customer, being customer oriented, does that force you to be innovative, do you think?
It does if you want to stay in business. And I
Hmm.
think oftentimes companies do come to the realization that if they don't innovate, they're going to get eliminated. But it's again easier said than done. I mean, the classic example is Blockbuster. Blockbuster had a monopoly. They had thousands of stores. They were doing the video rentals. They were doing really well. They were number one in the market. And this little startup company came along. In fact, the people over at Netflix wanted to partner with Blockbuster, and Blockbuster resisted because Blockbuster wanted to protect a good portion of their earnings, which was coming from late fees. And they realized, well, gee, if we partner with Netflix, well, then people are never going to have it late because it's just going to drop it in the mail, and those fees go away. And so they were so reluctant, and it was a grave mistake. They didn't see the market changing. And it's very interesting to me because the people who have the most to lose end up doing the least. And that always surprises me. Who better to come up with, as technology was changing, whether it was compression technology, bandwidth technology, digitalization, all of this confluence was happening. Who could have taken advantage of it more than Blockbuster, who had thousands and thousands of customers? Yet they were left basically out of business. I mean, Microsoft, to a certain extent, also had the best position in computing. And as the market changed from basically PC computing to mobile computing, Microsoft essentially missed the boat. And that really was catapulted Apple into the lead position, into one of the world's most valuable companies. But could you imagine you're in a company and you're a dominant position, you have more cash than you know what to do with, and some other company just leapfrogs you, and it's because of their ability to innovate. But the innovation is driven by consumer demand, consumer sentiment, consumer desire. So once you become disconnected, and oftentimes companies that have monopolistic characteristics, they do stop listening to their customer. I mean, we might even be seeing this now in search. I don't think you're getting a fair search with Google oftentimes when there's tons of censorship and they're guiding you in a narrative that may not be what you're looking for. And I think that that's going to open the door. In my opinion, it's going to open the door for alternatives. Google owns the market today, owns the market, dominant, 90+%
Mhm.
of search. I would not be surprised within the next 3 to 5 years that their market share erodes dramatically because of the censorship and because of the algorithms and all of the stuff that's gone on the last couple of years. They have a stewardship to their consumers to give the consumers a fair search option, and they're not doing it. And
Yeah.
so that's going to open the door, I believe, for competitors.
Well, you mentioned something there, Joe, that's really important, really difficult. You talked about consumer or customer sentiment and how they feel. And in that Google analogy, the way Mises talked about it was uneasiness. They can tell you they're uneasy. They can't tell you how to fix it, but they can tell you they're uneasy. And that's really hard to dig out. What's been your experience of being able to monitor that customer sentiment, customer feeling? It's qualitative, and I know you're a quantitative guy. So how do you do that?
Well, there's a couple of ways we do it, and one as an example is you can look at your financial results, you can look at your production internally to see if the tide's turning. And if the tide's turning, you have to dig into why it's turning. And the answer is in the customer base. So you have access to customers. You can go out and do surveys. You can talk to customers, and something generally tends to emerge. In our business, it was super important that our doctors, Medicus is a consulting company that provides physicians to hospitals all around the country. And our physicians are off site. They're actually in the hospitals doing work. So one of the things that was important to them was making sure that we knew that their time was accounted for at the end of the week and they can get paid relatively quickly. And so we needed the client to sign off on their timesheets. And it was very difficult to find somebody in the hospital who's the proper authority to sign the timesheet. So this was a perpetual problem, and it wasn't told to us by one doctor, but by many doctors. And so we knew that was an issue. And we also knew from our surveys when doctors left us, they said, well, we went somewhere else because it was easier administratively. And so we were getting that information, and we had to operationalize that to catch up to competitors. And then you go to the next step. So not only do you catch up, but now we jump them because we're using technology like building a portal, building apps on their phone. So we're making it very easy for the doctors to interact with us, and that's a competitive advantage. Now, of course, it's a cat and mouse game. The competitors they're gonna be left holding the bag. They're gonna recognize that, and then they're gonna do some more innovation. So it continues. It's an arms race of innovation.
Yeah. Or a system of innovation, which is good for customers.
A quick note. Did you know that we provide supplemental materials for each podcast? Listening to and understanding the key takeaways from our expert guests helps you think better about building a more beautiful business. Taking direct action and implementing these strategies is when the real work begins. Take a concrete, immediate step to implementing a better business model today by downloading the show notes and business tool we've created for this episode. Visit Mises.org/E4Bpod. That's MISES.org/E, the number 4, the letter B, POD, and click on today's episode. Now, back to our interview.
You said something fascinating there, that you're trying to see the tide turning, and that sounds like a little bit of a lagging indicator, and then you try and jump ahead and be the leader in coming up with the new apps and things like that. So can you stay in the lead, or you're always going to be looking for that turning tide that says you're lagging a little bit?
I think companies that are innovative and that have a culture of innovation, that they teach innovation, they reward innovation, they have that culture that accepts it. I think you can stay in the lead, because part of being innovative is always connected to the customer. So for things that we do internally, we do reward innovation. We do have a lean process in our systems. And what we tell employees, and employees see it themselves, is that when they make a mistake or when they try something, that's okay. No one gets fired for going outside the guardrails and doing something different, trying something different. And if what they try works, we go and we export it to the rest of the company, and that person gets the credit for that.
So, Joe, you mentioned lean there, and I always think of lean as a cost-saving, efficiency kind of approach, but you're including innovation and new possibilities under lean. So help us get that right.
Yes, because in any process in the company, as an example, you have a 15-step process. What you're pushing people to do is make that a 10-step process, an 8-step process. And in order to do that, you might have to add some innovation through technology, or maybe it's through different methodology of how people interact or how they work, or whatever you deploy to get it to be more efficient. And the end result is using innovation to get you there. So innovation is not always the iPhone coming from a flip phone. That's a great jump, but usually it's these jumps are not as they're not as major jumps as you think. They tend to be more incremental, and then one of the last jumps is a tipping point. So the iPhone didn't come out of thin air. It came from between the flip phone and, let's say, the Trio or the BlackBerry. And so the iPod, there was already MP3 players, so it didn't come from cassette recorders. There was already innovation happening, whether it was digitalization, it became smaller and smaller, compacting, etc. Speaker technology, everything gets smaller, and then all of a sudden you go from an MP3 player to an iPod that has a little display screen, and then you add the iTunes store, which really then made it mainstream. So it was a series of smaller innovations, and then bigger becomes the whole product becomes a bigger innovation. So that's one major way to think about innovation. The other way is through technology, through process and service. Medicus, we started out as what people call locum tenens, which is it's Latin for in place of. A doctor goes on vacation for a week, they would call us and say, "Can you bring a doctor in for a week in place of the other doctor who's out?" Absolutely. But what we were able to do over time is innovate our process, and we started to help with overall staffing planning over longer periods of time, and we managed their staff project based environment for, I don't know, maybe 3 to 6 months. They might have been in a situation where they were building a new department and they needed 4 or 5 doctors. We would manage that whole process for them over a period of time. That wasn't something that was done in staffing. Staffing was very reactive. We became proactive, and that allowed Medicus to grow dramatically. It was a completely different mindset, and the customers thought about us differently.
You mentioned efficiency, and I sometimes think economists lead us down the wrong path when they talk about efficiency, because you're trying to do maybe the same with less as opposed to trying to do more all the time. Another word I came across in a Silicon Valley study, Joe, was the Ambidextrous Corporation. And what they meant by that was you've got to be really good at relentlessly implementing what you know customers want every day, doing what you already do, and at the same time explore different areas that, as you say, it might be a mistake or it might not work out the way you think, but you got to be able to do that exploration. So you become ambidextrous. That's what they meant. Is that a good description of what you do?
I think it's a wonderful description. Consumers continue to change, their own expectations change based on their own experience. As an example, independent of Medicus, people have iPhones. And if anybody has an iPhone, knows how the ease of it with one button, and the screen is easy to maneuver and all of this. So people get used to that. So if you're not a competitor of the iPhone, but you deploy technology, you have to deploy it in a way that people are already used to. So the consumer has now changed. And I think that was one of Microsoft's problems. I don't think their software was usable. It was usable in the 1990s, but when you get into current day, Apple made the technology, the software so easy that other people had to really copy the look and feel of the iPhone because that's what people were expecting. So you have, and again, it goes back to my example with timesheets with our doctors. Somebody made it easier for the doctors. Now the doctors have a different expectation. We have to listen to what those doctors are telling us. We have to make it easier for them. Otherwise, we lose ground.
Actually, it brings an interesting image to mind, which is we talk a lot about frontline employees, the ones who actually contact customers, either directly as salespeople or maybe they're the customer service people. But actually, maybe today the smartphone is your frontline employee, right? They're the ones who are interacting with customers one-on-one, and they're sending data and information back that way. So maybe we should think of the phones as the frontline customers, frontline employees.
Well, certainly the phone is a tool in terms of how we interact with the customers, but one of the things that good companies do from an innovative perspective is they have mechanisms to extract the data from the frontline workers so they understand what's happening in their markets with their products. Because certainly those people, the salespeople, customer service people, they're hearing all of the complaints from the customers, all of the good and all of the bad. And it's not good for me to know it myself. I need to have a mechanism to be able to get that information to the CEO of the company through a structured process.
Yeah, so interesting combination of words there, Joe. Structured process. A lot of what we talk about in innovation is finding the right structure, and we talk about decentralized organizations or flat organizations, or somebody used the term bossless. There is no boss. Anybody can talk to anybody. How have you implemented that? How have you made that structured pathway from the frontline employee?
So there's a couple of things. We try to make it as less bureaucratic as possible by flattening the organization, but we also have mechanisms, structured processes that allow people to be able to input their experiences, and we document those experiences so it makes its way through the organization. We make that information public within the managers so people can understand what is happening. So it is funny because there is competing forces here. We want to keep things structured, but you can't overly structure it. That takes away from the creativity and it keeps them too much in a box.
Yeah. So the word mechanisms there is fascinating too. Jeff Bezos talks about this all the time, that it's not the structure that works, it's the mechanism that works, the mechanism that gets that information to the right people in the corporation. So maybe we should think of mechanisms, not structures.
Right. Yeah. Well, that's true. That's true. And people need also, I think there's this notion that people will be more creative if you allow them to be more autonomous. And it struck me the other day. I went out for lunch and I ordered a salad, and I knew that they had, based on the other ingredients and other dishes, I knew they had olives and tomatoes and all kinds of other stuff. So I ordered this particular salad, but it didn't have all the ingredients that I wanted. So I had asked the waitress. I said, "Well, do you mind? I want these Italian olives, and I want this kind of tomato." And she said, "I don't know if I can do that." And I didn't know what to say. I said, "Well," I said, "Oh, are you worried that you don't have the ingredients?" She said, "Well, I don't know. I mean, that's not how it is. So I'll have to ask my boss." Now, I know this is an anecdotal story, but it's instructive here. First off, that's part of that is to some extent poor training, and part of that is a bit command and control, because if you give her or him autonomy to be able to solve customer problems, nobody would be better at it than the people interacting at the front line. And so she knows what she serves. She knows the ingredients. The answer should be certainly, we'll be happy to make that kind of salad, because we weren't asking to do something that was so far out of the ordinary. We weren't asking for something that they don't serve, they don't have in stock. We were just asking to modify, an existing salad with ingredients that we know that's in stock that goes in other dishes. So it wasn't a huge deal, but yet the culture of the restaurant was such where she didn't feel like she had the authority to make that decision. And so really, if you play that out and you think about it in a corporate setting, if you're in sales or manufacturing, or anytime you're interacting, if you have the ability to make a change in real time, the organization should reward you for that. But oftentimes, we're so worried about compliance that they put people in very strict criteria in boxes where they don't have any flexibility, and it leads usually to customer dissatisfaction, or it leads to a process that's outdated, because people know firsthand that this is not a good process because they're living the process and they see the holes in it. The trick is to allow them to experiment or to articulate what those problems are. No one knows
Yeah.
it better than them.
So
So the idea, like at Medicus, the idea, we have hundreds of employees. I would much rather hundreds of brains thinking about solving a problem than me trying to solve a problem that I'm five layers disconnected
yep.
from.
Yeah, we use the term liberating the value creation capabilities of those frontline employees, not constraining them, not making them compliant, as you say. The other question that comes up when you start talking about this challenge, Joe, is hiring. So yes, we want to make those frontline employees and everybody innovative and autonomous and empowered. You got to hire the right people to be able to do that. Is that something that you spend a lot of time on when you're thinking about innovation?
Yes, absolutely. Um, we do a couple of things on the front end. We try to interview them in detail and try to understand if they have a flexible mindset, and we do some testing on that to see if they really do have a flexible brain, meaning that they're able to adapt to change. 80% of the people will do change, but reluctantly. If you can find and there's 20% of the people that will not change. So that's it. That they are who they are, and they're not going to change. The other 80% of people, will change. Some reluctantly, some will go along with it, and others will be more open to it. So if you can identify people in the workforce to come into your company already with an open mind, who are flexible like that, it makes it easier as the company
Yep.
continues to change.
And you give them an environment that says welcome, and we're encouraging you to keep adapting. And
We're
yeah,
encouraging you. Yes, we're not only encouraging, we're employing you. We want you to change the status quo. We want you to think of ideas. We want to make this company better.
yeah.
So we strive to be the best that we can be, and in order for us to achieve that, they have to contribute to that goal.
And do you package that in internal communications, Joe? People talk about purpose statements or mission statements, and do you spend a lot of time
Yes,
on that?
we do. We do. It's part of our mission. It's part of our purpose. It's part of our objectives, and we talk about it quite often. And we reward them. We
Yeah.
reward them for that. No one gets in trouble for coming up with an idea that may or may not work. We appreciate and we respect the fact that they're thinking about it.
So this is a little bit of a diversion, but I know we started discussing it last time and didn't continue it. There's a structural or process change happening in your industry now that we're calling direct primary care, and it's kind of removing the bureaucracy from the doctor so that the doctor-patient relationship, that frontline relationship, can be strengthened. I know you've observed some of that innovation. Can you tell us if you see that as a major change that's coming to your industry, direct primary care?
I think, yes, in one of our businesses, the idea of direct primary care is to have 24/7 access to a nurse practitioner, or doctor, and you use technology, whether it's texting, telephone, iPhone, or FaceTime, email, however you need to communicate, but you have immediate access to a doctor. And I think the evolution of that industry is such where you start to wear wearables where it recognizes and tracks oxygenation levels, heart rates, etc. And so if something goes afoot, the doctor immediately can intervene and give you a call and say, "Hey, I noticed that your oxygenation is lower. maybe you're in early stages of pneumonia or something. And so the earlier you can intervene in medicine, typically the better. And so this is a model that is super customer patient centric. You wake up, gee, I don't know, my eye's a little crusty. I don't feel right. You take a picture of it, you text it to the doctor. The doctor takes a look at that. The doctor has a quick conversation, recognizes it as pink eye. Immediately, you start treating it. Immediately. And the best part about it in this network is the doctor can follow up, in the next day or two and see how your progress is working. Medicine is heuristic. You don't always, we're complicated beings. So I'm going to give you this antibiotic. I think this is the right protocol. Your body may not respond to it, although 90% of the people it responds positively to. You might be different. That's why we're going to monitor it. 2 or 3 days later, I call you, say, yep, things are great. It's worked. And so this model has that capability, and it's super convenient. You're not driving across town, waiting in a waiting room with 5 other sick people. You're not getting stuck in traffic. You're not missing work. So it's one of these things where it's super convenient, and I think it's going to keep people out of the urgent care centers, and it's going to keep people out of the ERs. Certain percentage of ER visits would be avoided if there was early intervention. And unfortunately, people don't have a mechanism to get to early intervention because it's either too costly, or they don't have access, or there's too much of a waiting list. You call your doctor and he says, okay, come in Friday. Well, today's Tuesday. I can't wait by the time we wait, it devolves into something much worse. And I mean, quite frankly, we've seen this with COVID, unfortunately, where there was not a lot of early intervention. Hospitals weren't treating COVID, even though there were plenty of studies to suggest that multi-sequence drug therapies would have been very effective at eliminating or reducing hospitalization or death. Yet the medical community, by and large, did not implement that. In fact, the FDA and the CDC were sort of against hydroxychloroquine and ivermectin, drugs that have been on the market for decades and have been very effective and is shown to be very effective in early treatment of COVID, yet was sort of discredited by the medical community, really at the expense of people's deaths. And that, I think that was very, very unfortunate. But it just illustrates the point of early intervention. And this model is very, very powerful, but it's going to have resistance. The people who are going to resist this is the establishment, the insurance companies, hospitals. It's not necessarily going to be widely accepted immediately.
Yeah, the bureaucracies, in other words.
Yeah, well, also the other thing, it's the bureaucracy, but it's also the medical model. Hospitals don't make any money if you can get treated in an outpatient center. So the way they make money is to treat you, not to prevent you, but to treat you. So that's a model that is a bit dated and probably should change.
Yeah, right. Well, you've really summed up innovation there in a wonderful way, Joe. I thought of the doctor-patient relationship, which is kind of old-fashioned when you talk about direct primary care. You talked about technology, you talked about wearables, you talked about decentralization, you talked about faster communication, eliminating wasted time, more convenience, and earlier and faster intervention for better results. So a system of value.
And the best part about it all is it's done in a way where it brings more accessibility and at a price point that's much cheaper, much more affordable. So it's a way to democratize. It's a way to allow millions of people to have access to care they otherwise wouldn't have.
Well, good. That's a great vision for the future, Joe. We have to wrap up for time, but you've given us a very comprehensive way to look at innovation, both from the firm point of view and from the market point of view. So we'll try and sum it up and we'll try and capture this, but thank you so much for sharing all of your insights and experience.
My pleasure.
Economics for Business is a production of the Mises Institute. To explore more content like this, visit Mises.org. And for more from Hunter Hastings, visit hunterhastings.com.